Good afternoon. My name is Loren Robinson, and I am a second-year clinical scholar in the Robert Wood Johnson Foundation Clinical Scholars Program here at Penn. We are honored and fortunate to be joined today by Dr. Risa Lavizzo-Mourey, President and CEO of the Robert Wood Johnson Foundation. Risa, thank you for joining us.
My pleasure.
So we had a great afternoon with you. So far, we've been able to hear you give a keynote and talk about the culture of health and what great changes we can expect, hopefully, for our country.
Yes.
And we're really excited that the foundation is spearheading the effort. And we just had a wonderful conversation with the Robert Wood Johnson Clinical Scholars with you, and we really appreciate your leadership. And one of the questions that I think has been on a lot of people's minds is, as the foundation has made the very difficult decision to end the Clinical Scholars Program, what are your thoughts, and do you have any second thoughts or feel like that things could have been done differently, or there's a different approach to ending the Clinical Scholars Program? And do you worry that as an alum of this prestigious program, that there are going to be now less physician leaders and less Risas in the world? And for those of us coming in your footsteps, what can we expect from the foundation?
Well, there's a lot in there. First of all, I don't know that you need a lot more Risas. We may not need that at all. The decision to transition the Clinical Scholars Program was a difficult one because, as I've said many times, the accomplishments of this program are so incredible. At the same time, we recognize that the kind of leader that we're going to need going forward to really build a culture of health is going to have the skills and curiosity, the expertise, the ability to make change that the clinical scholars have, and we need physicians who can do that. But we're also going to need those physicians to be able to develop relationships with leaders from other professions, to work across sectors, to understand how to work not only in their own geographic environment, but to work virtually. And so it's a good time when the program is doing so well to think about how do we add those components to it. I think everyone who's looked at the American health workforce concludes that we can't do it the way we've done it in the past. We can't do physician and other professional training in a siloed way anymore. We've got to be able to work in teams and to work across sectors. So that's the kind of skill set that we're trying to build into the next generation of the program. And I think that in a lot of ways it's a transition. To describe it as ending and then restarting is so jarring, and actually there's not going to be any break in scholar enrollment. We will be admitting the next cohort of fellows just as this one is ending. And so in a lot of ways it's more of a transition than a stark ending. But we want people to understand it will be very different than it has been in the past. I think that it will be bigger. There will be more scholars around the country. They'll be in places around the country where we don't have scholars training now. And so that, I think, will clearly be an enhancement. I don't know that it's the number of doctors that get trained so much as the way that they are able to interact with other disciplines and professions in the future. So I'm having a hard time seeing the negative of the future, except to say that I know there is a tremendous loyalty and camaraderie that develops during the 2-year fellowship. And I have to say, when we've talked to lots of people who have been in fellowships that weren't site-based, like the Clinical Scholars Program, they tell us that kind of camaraderie is possible to develop even when you're not all in one site. So we've challenged the people that are helping us with the design to show us how to make that happen.
I think as we wind up, one thing I definitely think that the current scholars and alums would love to know is if there are ways that we can be helpful to the foundation in promoting not only the culture of health, but also the future direction of the Clinical Scholars Program, and if you have suggestions for that.
Well, I think first of all, letting people who you know would be interested in the Clinical Scholars Program know that there will be a program for them to apply to. It's going to be a broader program, an exciting program. They should stay tuned for that. And more importantly, as you think about your career, and for those that are already alums, try to think about ways that you can stay connected to these new scholars, because just as you turn to the alums for inspiration and mentoring and problem solving, we will want them to turn to you. And as you progress in your career, that's going to be even more important. So if I have a plea, it's to stay connected to the program, stay connected to the future scholars, and continue to help them understand how to be leaders as you develop into leaders that we can envision but don't know exactly where you're going to go just yet.
Okay, well, Dr. Lavizzo-Mourey, we really thank you for your time, and we really appreciate your candor and honesty this afternoon.
My pleasure.
Thank you.